Namaste, dear students. First of all, let me welcome you to our English class of grade 9. Dear students, you have already learned the text of Unit 1 and today we are going to begin Unit 2. So for it, you have to have your English textbook, notebook and pen or pencil. Are you ready with them? Good. If so, now you have to be ready to learn the text that is given in Unit 2. So are you ready? Well, if so, now you can see getting started. So what do you see there? You can see, look at the picture and discuss about the meaning of the health. So these all words are related to our health, okay? You can find health is written in big letters, and you can see many words around health. It means that there are many factors to be healthy, okay? You can see, for example, athlete, motion, happiness, environment, fit, sport, running, relaxed, diet, mind, fitness, relaxation, happy, muscle, living, mental, care, medicine, nutrition, many more. It means that we need physical exercises to be healthy. And at the same time, we need recreation, amusement, entertainment, and we need rest also. These all words are related to our health. And at the same time, we should not forget balanced diet, okay? So from this picture, what do we guess that we are going to learn today? Can you tell me? With the help of this picture, if you have understood about health, it means that there are many factors to be healthy, okay? So based on this picture, can you guess what are we going to discuss today? What is the text about? Can you tell me? Well, the text is about again health. So for it, you can look at reading 1. So under reading 1, what is there? Fine. There is, before you read the interview below, answer these questions. Now look at this picture also. Okay, and we have questions here. The first question is, how do you get advice from a doctor? Have you ever been to a hospital? Have you ever seen a doctor? Yes. So at that time, how do you get advice from a doctor? Okay. So you might have gone to hospital physically, and during pandemic, if anyone is sick, ill in our family, then what did you do? Did you go to a hospital physically? It was locked down, What did you do? And how did you get advice from a doctor? So it means that maybe through telehealth service, okay? Maybe online service, you can say in simple term. Is it clear, all of you? Now another question we have is, what do you know about telehealth services? Do you have any idea about telehealth services? Now you have to look at this term, telehealth. Have you ever heard this term? Telehealth, what does it mean? Oh, it's interesting and maybe new term for you. So you can guess and later on you will find its meaning in our text, okay, about telehealth services. After the discussion of these questions, dear students, now you can look at about the text. And what is the title of our today's text? Can you tell me? You are right. Our title is The Acceleration Behind Telehealth Services. Now, acceleration. These days you can find people use telehealth services a lot, and especially during the pandemic of COVID-19. See, you have faced COVID-19. And at that time, there was lockdown. We could not move very freely. There should be social distance among the people, At that time, it was really difficult for us to go to a hospital. And at that time, people could get health facility through this type of service. That is what we call telehealth. It means that you can stay at your home and the doctor is again at his house, and then with the help of internet or with the help of online mode, we can get health facility. That's what we call telehealth services, and it is increased, Many people like to use it. And this is what the title suggests us, the acceleration behind telehealth services. Is it clear, all of you, about the title? Very good. Now, you can see the background. What is the text about? You need to know, okay? See. In this interview, I hope you might have known the meaning of the word interview. Interview means there can be two or more than two persons and a reporter asks questions and the interviewee gives answers. Okay, this is what we call interview. In this interview, Chun Kai Chang, the business development manager of telehealth at Advantech, talks to News Medical about the acceleration behind telehealth services. Now you can find there is a person whose name is, can you tell me? All right, his name is Chun Kai Chang, okay? And he is the business manager of business development of telehealth at Advantech, okay? And then he is talking to the reporter, okay, of News Medical. And what about the increment behind telehealth services? Okay, this is the background of the text. So without any delay, let's begin the text. Now, the reporter asks the question first. See, the question is, to begin, can you give us a brief introduction into telehealth and what it involves? Dear student, now Chang, the manager, responds like this one, okay? He replies, he answers like this. You have to read with me, okay? Today I don't want to discuss, I don't want to explain the text myself. Instead, I want to ask you some questions. You just read, try to understand and answer me. Okay, is it clear? I think it can be a new way of learning this text. Okay, now first of all, let me read. Telehealth is a method of providing medical care remotely, usually through video chat. Telehealth makes it possible to connect patients and clinicians from any location. It provides access to a wide range of care, including primary care consultations, psychotherapy, physical therapy, and even emergency services. It allows primary care clinicians and specialists to further their reach for treating patients wherever there is an internet connection. Now, I want to ask you a few questions based on this answer of Chang. Okay? So now, first of all of you tell me, what is telehealth? Yes, telehealth is a method of providing medical care remotely, okay, especially using internet and through video chat. You are correct. And what type of services can be provided through this service? Yes, you are right. Primary care clinicians and specialists to further their reach for treating patients wherever there is an internet connection. It means that generally you can say primary, let's say, advices, and of course we can do some chronic diseases also. So it is very useful, especially during the pandemic. And these days people like to use this method very much. Okay, is it clear, all of you, about telehealth? So this answer of Chang says us about telehealth service. Is it clear? Good. Dear students, at the same time you have to notice these words written in different ink, highlighted one. See, clinicians, psychotherapy, you know, and you have to just guess the meanings of these words with the context in the text, and you just note it down in your notebook, and later on I will ask you the meanings of these words and I will help you also. Is that clear, all of you? So the first word is clinicians and another word is psychotherapy. You can pronounce with me once. Clinicians, see, C-L-I-N-I-C-I-A-N-S, clinicians, and another one is P-S-Y-C-H-O-T-H-E-R-A-P-Y, psychotherapy. What is it? Psychotherapy. Is it clear, all of you? Good. Now, again, see, Chang is adding the benefits. What are the advantages of telehealth? Okay, you have to find out. The benefits of telehealth for healthcare providers and patients is that these services can be faster, safer, more effective, and less expensive in the long run, especially during a time like the COVID-19 pandemic, where telehealth has allowed access to medical care without going to hospitals to protect patients and hospital staff from being exposed to the infection. Now you have to tell me, what are the benefits, advantages of telehealth service? Can you tell me? Well done. They are, let's say, faster, safer, more effective and less expensive. Okay. Why faster? Because we can get it through video chat with the help of internet. Okay. Safer. Why? Because we don't need have any physical contact. It means we don't need to go to hospital, we don't need to see a doctor. Staying at our own home, we can get this facility. More effective. See, through the video chat, the doctor can check up us also and give us advice also, and at the same time it is less expensive. You don't need to go, you don't need to pay taxi fare or transportation fare, this, that, so it's, let's say, less expensive. Is it clear, all of you? Now, and it is very much useful in what situation? Can you tell me? Yes, you are again correct, during COVID-19 pandemic, So I have already told you that it was locked down even in our country also. People could not come out of their houses, and at that time we could get this facility. So it's using very much. Okay. So is it clear, all of you, about this paragraph, about this text? Nice. Now again the reporter asked a question. What are some of the main drivers behind the acceleration and momentum of telehealth services? And dear students, in this I have already told you that you have to notice this highlighted word. Okay, here is pandemic. You have to notice and you have to guess the meaning of this word yourself. Later on I'll ask you. Okay. Now another question asked by reporter is, what are some of the main drivers behind the acceleration and momentum of telehealth services? Again asking why people like to use this telehealth service more these days, The reporter wants to know, and Chang answers like this. See, there are two major drivers. How many drivers are there? There are especially two major drivers, two reasons, why people like to use this telehealth service. For this fast growing market, one is fast growing market. For example, these days you people don't like to go to the market. Instead, you can just call and you can order through online, and the things are delivered at your home. Very easy, So here is also fast growing market. Okay. The first and most recent driver for telehealth has been the global COVID-19 pandemic. I have already told you that. Our country was also locked down. We could not go out, and at that time what to do? And if we got sickness, at that time there should be an alternative way of getting treatment, and this telehealth is the one. Okay, so because of this reason. Another, strong social distancing and minimal physical contact precautions have pushed the shift to telehealth and remote consultations as it aids in infection protection. Another is that we have to keep social distance, We cannot go very close to the person. There should not be any physical contact among the people, And because of this reason also, people like to use these very much. Okay, so you have to remember these things. Is it clear, all of you? Well, now again Chang is adding, these precautions and increased hospital bed shortage have forced medical facilities to incorporate more telehealth technologies to keep up with demand and maintain care continuity for patients at home. Another thing that, see, shortage of hospitals bed at that time, and even there was lack of oxygen, shortage of oxygen. I think you might have heard this news. So because of these reasons, people like to use. This telehealth service is accelerating, using very much, because of this reason. Okay. Now, this is the first driver that it makes people to use telehealth service. Now, another driver you can find here. So can you tell me what is the second driver? You just read and try to tell me. Well, the second driver is the shortage of medical professionals when demand is increasing in every year due to an aging population. And another driver of using telehealth service is that shortage of medical professionals, maybe shortage of doctors, shortage of nurses, shortage of trained medical persons, because of this reason also. So you have to keep it in your mind. Patients with chronic and non-communicable disease, for people living in rural areas, their medical demands are undeserved due to insufficient resources and long distances to drive into cities for care. Telehealth is one of the promising ways to tackle the challenge of doctor shortages and expand specialists and doctors' reach to patients. And because of this reason, these days, this telehealth service can address the problem, like shortage of hospitals bed, shortage of medical persons like doctors, nurses, and trained persons of hospital, so it can do. So this is the second driver of the acceleration of telehealth service. And here also, dear students, you have to notice these highlighted words. This is incorporate. You can pronounce with me, incorporate, okay? Another one is chronic, C-H-R-O-N-I-C, chronic. And another word we have is undeserved, okay? Incorporate, chronic, undeserved. And there can be more unfamiliar words for you. And for those words, you can consult your dictionary, okay? You can consult your either e-dictionary or hard copy dictionary. Now, again, the reporter asked another question to be clearer about this telehealth service. And what's the question? You all read, please. In terms of this acceleration and momentum of telehealth services, we are currently seeing what are some items we can expect to see in the future. Now, people like to use this telehealth service more and more these days, and the reporter is curious to know about its future use. And Chang answers like this. Telehealth will not replace face-to-face care services, but we will incorporate it into healthcare facilities infrastructure. Patients will be selecting providers based on their accessibility to telehealth services, with more access to doctors, increasing patients using preventive care services, and follow-up care due to convenience will start to emerge. These can lead to fewer readmissions and patient complications. We'll also see more use for early screening of patient triage in the field before they arrive at hospitals. Now, about its future, Chang is saying that whether this telehealth can replace face-to-face service or not. What do you say? Please tell me based on this text. Oh yes, it does not say telehealth will not replace face-to-face care service, but we can include it. This telehealth service can be included in this system of treatment, okay? So it cannot replace, we cannot only use telehealth service, okay, instead of face-to-face one, but at the same time, we can include this system, okay? And another important thing is that it will be safe. Follow-up care due to convenience will start to emerge. And after getting checked up, you don't need to go to hospitals one after another time for your follow-up activity. Okay? Just follow your follow-up. You can get this system or you can get this facility staying at your one home. So because of this reason, in the future also, this service will be used much. So Chang is optimistic, hopeful that it will accelerate even in the future also. Is that clear, all of you? Now, again you can see the words incorporate, it is repeated here. Now, another one is convenience. So, C-O-N-V-E-N-I-E-N-C-E, convenience. Okay, again you have to guess the meaning of this word. And another word we have is triage, T-R-I-A-G-E, triage. You can pronounce as triage. So later you have to tell me the meanings of these words, just guessing in this context. Okay, so it's a new way, yeah? Good. Again, the reporter asked another question, and the question is, when it comes to remote patient monitoring for clinicians, what impact does telehealth have on these? And again the reporter asks that, what is the impact or effect of this telehealth service on the patients who are from remote areas? Okay, and Chang says like this. You also read with me. Remote patient monitoring could be one of the applications of telehealth. Remote patient monitoring usually involves continuously collecting patients' health data through wearable devices such as vital signs and blood sugars. The patient's data is then transmitted in real time, monitored and reviewed by medical providers. In this way, medical providers could acquire a whole picture of a patient's health condition and give a more precise diagnosis. See, this is what. So monitoring will be there, okay, so that a telehealth service provider will get all the data of the patient, and from those data then they can diagnose the disease and they can give advice and they can treat, So it's very interesting. We don't need to go to hospital, and it's really difficult for us to come to hospital from a remote area. It becomes more expensive. We have to spend many days, much time because of this reason. So in the future also, this service will accelerate, will increase, So here also, dear students, you can find another highlighted word, that is diagnosis. You pronounce with me once, diagnosis, D-I-A-G-N-O-S-I-S, diagnosis, okay? Now again reporter asks another question, that is, how has telehealth shaped the way clinicians work with each other? Now how do the clinicians work with each other, okay, through this telehealth service? Now Chang says, clinician to clinician, telehealth services have enabled medical professionals to collaborate virtually with specialists in other locations to deliver treatment and care to patients jointly. And these days the word virtual is not new to you, because during pandemic of COVID-19 you might have learnt your lessons with your teacher through virtual mode, or in another words you can say online class, okay? And here also the clinicians can connect, they can interact virtually, and they can share their ideas, their professionalism, and that's how they can make it more useful also, okay? This service can range from remote surgical mentoring to tele-ICU and tele-ER, like a stroke, in which one site staff work together with a remote physician or specialist team to assess patient's condition. Telehealth solutions relieve the pressure of staffing gaps seen in critical departments such as an emergency room and ICU. So it solves some problems also, like we have already discussed that. So bed shortage, shortage of medical persons like doctors, nurses, and our doctor from far away also can treat another person in the remote area, and they can connect, they can interact, they can share their ideas of professionalism, and they can provide their better services to the patients, okay? So this telehealth service is very fine, very useful, And here also you can find the abbreviated form, short form of the term ICU, and I think this term is familiar to you. So what is its full form? You have to tell me later, okay? ICU. Now reporter again asks, what would you say are some of the biggest challenges clinicians currently face with telehealth? Now, it is not only the opportunity, it has challenges too. Now, what are the challenges, Mr. Chang? The reporter asks. And Chang says, many hospitals are still facing the lack of infrastructure to implement telehealth successfully, insufficient hardware, and the right technology for its specialty. Some hospitals struggle with reliable networking infrastructures like broadband, 4G, or Wi-Fi. This could limit the connectivity within facilities and provide remote care to rural areas or mobile clinics. Having the right technology and tools and place will be crucial to successful telehealth programs. And telehealth means we have to use the science and technology tools, like internet, laptop, desktop, and at the same time there should be infrastructure for the implementation of telehealth. Okay. Another, there is the problem of insufficient hardware, not enough hardware, and the right technology for specialty. For all the disease, there may not be technology, And another thing, see, some hospitals struggle with reliable networking infrastructures. Maybe they may not have that reliable networking infrastructures, and like for example broadband, 4G or Wi-Fi, even internet connection is very poor in some of the parts of our country, So these things are there, and Chang says that these are the biggest challenges for the clinicians currently while using this telehealth service. Is it clear, all of you? If so, he adds more, even though this new technology is quickly being integrated, there is a learning curve to using telehealth versus traditional healthcare operations. Users face obstacles such as learning to use different tools, online scheduling for virtual visits, triage procedures, and billing policies. To overcome these challenges, now these are the challenges, and I hope you might have got some ideas from here also, and how can we solve. At the same time, Chang is suggesting us to solve this problem. Say, to solve these challenges, telehealth should be encouraged as a regular service and included in health insurance. It should be included in health insurance, and at that time we have to regulate it. Okay, so if we regulate it, then there can be more infrastructures, there can be, let's say, necessary things like 4G, broadband, Wi-Fi, many more things. So there would be more motives for healthcare providers to invest in infrastructures and information system integration and deploy telehealth technology. Okay, so these can be possible solutions for these problems. Dear students, now here is one more word, deploy. You can pronounce with me, deploy. Okay, later on I'll ask you the meaning, you just guess. Now after this we have to do a task. So I hope you might have got some ideas, and don't forget to read your textbook also. Okay, so now let's do a task. The task for you is, let's say, dear students, I have already told you to guess the meanings of the highlighted words. Now you have to do this task. Okay, it is crossword puzzle, and we have the instruction. The instruction is, the meanings of some of the words from the interview are given below. Find the words and fill in the crossword puzzle. So without any delay, let's begin. Across 1, psychological treatment of people using dialogue. So what is the correct word for it? You can tell me. Psychotherapy, psychotherapy. So what is the word? Psychotherapy, psychotherapy, psychotherapy. Now another one, process of sorting patients. So what is the correct word? Now you can write down triage, 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 triage. Now another, to prepare and arrange. Number 3, what can be the correct word? Now it is here, all of you tell me, deploy, deploy. Okay, deploy. Now another one, special treatment of a hospital for intensive care of patients. So what is the correct term? Now you can write down ICU. Okay, intensive care unit, full form. Now let's go down. To include as a part. Now number 5. Where is 5? You can sit down. Here, see. INCORPORATE, incorporate. Okay, incorporate. Now another word you have to find for identification of nature and cause of a disease. Now number 6, it begins with D. What can be the word? Of course, DIAGNOSE, diagnose. Okay, what is it? diagnose. Now another one, not having sufficient service. Number 7 you can find here. So what is it? UNDESERVE, undeserved. Okay, UNDESERVE, undeserved. Now another we have is number 8, epidemic over a wide geographical area. What is that? For example, COVID-19. Yes, PANDEMIC, pandemic. See, these are the words for the given meanings. I hope you might have done together with me. Have you done? Very good. If so, now we have another task. Read the interview again and write whether the following statements are true or false. You can tell me whether true or false. Internet service is necessary to use telehealth services. Is it true or false? You can check with me. Yes, it is true. Okay. Now number B, while providing telehealth services, health professionals are at high risk of being infected due to the exposure to patients. It means that while we are using telehealth services, at that time, for example, doctors, nurses can be suffering from disease. So is it true or false? To be safe from that one, it is very useful. That's why this statement is false, because they won't be at high risk if we use this telehealth service. Okay. Now number C, telehealth service can be the best alternative to a face-to-face service. Is it true or false? What did Chang say? Will it replace face-to-face service or not? No, it will not replace face-to-face service, but it can be incorporated, That's why it should be false again. Have you written false? Well done. Now number D, the problem with the lack of medical staff will be solved to a great extent with telehealth technology. So if there is shortage of manpower, hospital beds, it helps, it solves that problem. Is it true or false? What did Chang say? Can you remember? Yes, Chang says it helps to solve this problem. That's why you have to write down true. Okay. Now the last one, the success of telehealth programs depends on the infrastructure and the best use of IT tools like broadband, 4G, Wi-Fi, and other infrastructures. So is it true or false? Well, Chang says these things are essential. So you have to write down true. Dear students, now we have last task based on the text, that is answer the following question. So number A, you can see what is telehealth service. In the beginning of our lesson, when I read the first paragraph, I asked you and you told me very rightly. So what is it? What is telehealth service? Can you tell me? Well, you can check now. Telehealth service is a method of providing medical care remotely, usually through video chat. You can find this answer in the first paragraph. Okay. Now this is the full answer. Now from B, I want to give you only the major ideas, and in comprehension you can just write down main ideas only also, and based on main ideas you can develop full answer. Okay. For example, number B, what are the advantages of using telehealth programs? There are given benefits. When Chang says, so what are the benefits of using telehealth programs? Can you tell me? Yes, it can be faster, safer, more effective, and less expensive. You can find it in the second paragraph of your text. So if you want to write it down in complete sentence, you can write down the advantages of using telehealth programs are faster, safer, more effective, and less expensive. Okay. Now number C, why, according to Dr. Chang, is the telehealth service growing rapidly? Now what's your answer? You just try. Well, your answer should be global COVID-19 pandemic. Okay, growing rapidly because this type of pandemic, and you can develop it into full sentence, and in comprehension we can find out only major ideas also. Okay, now number D, how is the telehealth program important during a pandemic? How? Can you tell me? Yes, it can be tackling the challenge of doctor shortages and expand specialists and doctors reach to patients. Okay, so you can develop it into full also, and you can find this answer in the 5th paragraph. So later in your free time at your home, you can search in these paragraphs. Okay. Now number E, why are the patients in remote areas not getting adequate health services? In the remote parts, why patients do not get enough health services, sufficient health services? Can you tell me according to Chang? C, hospital bed shortages, the shortage of medical professionals. This answer you can find in the 5th and the 6th paragraph of the text. Now the last question we have is, mention the top 3 challenges of telehealth services. 3 challenges we discussed there. So can you tell me? All right, they are lack of infrastructure to implement telehealth successfully, insufficient hardware, and the right technology for its specialty. Okay, you can find it in the 10th paragraph. Dear students, these answers are your guidelines. Based on this one, at your home in the free time, you can again write down. Okay, is it clear all of you? After this, I have a task for you. Can you guess what is it? Yes, it is home assignment for you, and that is, how might rural communities feel about telehealth services? How could this be improved? Talk to your friends. Now you can discuss with your friends how might rural communities feel about telehealth services, whether they find this telehealth service is useful or not, whether that benefits them or not, and if not, how it can be improved. You can discuss with your friends and try to find out the solution. Okay, is it clear all of you? So don't forget to do it. Dear students, now we have come to the end of our today's class. I hope you might have fully engaged and enjoyed and better learned about the text under the theme health and hygiene about telehealth services. Please keep watching us. Don't forget to practice in your free time. It's all for today. Have a good day. Bye-bye.